And so one of the things I've noticed, you do check fasting insulin levels.
Yes, we do.
Now, what is the importance of checking fasting insulin levels?
It is kind of a baseline sugar level to see what your body, how your body processes sugar. When you eat something, the body has to, process it, get rid of it. Fasting is at your baseline, what the most minimal blood sugar level is at your body at rest.
So I notice a lot of doctors are scared to prescribe testosterone. What is the reasoning on this?
The reasoning is this: number one, you have to have some definitely education. You have to have some experience, and testosterone, at the end of the day, is a want. It's not a need. I mean, there are certain medical diseases that do require testosterone therapy, and those are well documented. It's a handful of therapies, but for the average citizen or patient, testosterone is a want. So you have to be able to prescribe testosterone in a very safe level, not to exceed expectation, not to, if you take that part out, prescribe testosterone so as the patient does not get harmed, because it is truly a want, not a need, for about 80% of the population.
I had heard that the testosterone level is 300 to 1,000. Now, that's just off the basis of the United States and what people are testing at. Now, have you ever met someone has a testosterone range of 800 that feels like crap?
Yes, and then in that case, we have to make sure it's not a thyroid issue, any mental issues, emotional issues, depression, anxiety, vitamin deficiencies, heart disease. So there's many other reasons. I've also had patients whose testosterone are in the 300s and they feel great. It is almost patient dependent on the testosterone level.
And then I've heard studies where 600 milligrams of testosterone cypionate per week has shown beneficial with very little side effects when you manage the estrogen conversion and the DHT conversion.
Right, and you have to manage those. You have to manage those very carefully. You have to watch it very carefully. But once again, the general population has to understand, testosterone is something that can enhance your life for most patients. A true need, like a diabetic medication or cardiac medication, not so much. But when a doctor has spent plenty of time in the hormone realm, all the little pitfalls you are aware of, you truly try to manage. And this is what we do with MDVIP. We get labs every 3 months, sometimes every 6 months. The patient's stable. The patients see the nurse practitioner or myself for about 30 minutes, and we do not make any increase in medication unless it is very appropriate and no potential damage to the patient.
Okay. What do you think of the people using prescription Anavar prescribed by their doctor?
It is difficult to answer that question because, Anavar currently, I think, is not FDA approved right now.
Okay.
So it's an individual basis question per patient. We have seen some abnormal liver enzymes with Anavar. But Anavar does improve muscle and mass. And
it's used a lot, in burn victims? Wound healing?
That I do not know.
Okay.
That I do not know.